When parents come home from the hospital with a new baby, they are told to always put the baby on his or her back to sleep. This is a really big deal. It's an initiative that has reduced the number of cases of sudden infant death syndrome by 50%. But while we're seeing fewer deaths from SIDS in the last 20 years, there's a new problem caused by the way the babies are sleeping. Here's how one local doctor is now trying to make a difference.
Caitlin's 5-month-old son Easton has plagiocephaly, or in simple terms, a flat head.
All of our family would always ask us, well, when's it going to go away, or is it going to go away?
The Firestone, Colorado family has a 2-year-old as well, but he never showed signs of the flat head. It's something Caitlin is worried about, not just because of how it looks, but she's worried about Easton's development.
It does raise concern because you don't know if it will halt some sort of development in the brain when they grow to adolescent or adults. It's your baby and it's cute, you know, either way.
Caitlin is not alone. We found dozens of families in Colorado worried about their flat-headed babies, including Carrie Simmons.
They are a lot of work, but a lot of fun too.
Carrie has twins. Kai has a flat spot so severe, doctors decided to treat him with a helmet.
The way the helmet is designed, he will make up that area. So the flattening will round out.
The helmet therapy is the only current treatment local doctors are using for plagiocephaly. But there is a doctor right here in Colorado doing what she can to prevent it.
Flathead syndrome is really grown to almost epidemic proportions in the last few years.
Pediatrician Dr. Jane Scott has watched the number of plagiocephaly patients explode. She says it usually happens a few months after birth.
1 in every 2 to 3 babies actually have some element of flathead syndrome by the time they're 5 months old.
But it's not just the way the baby's sleeping in the crib that's causing the flat head. It's often the modern conveniences we have as parents, like the car seat that goes straight into the stroller and then back out and inside when the baby's sleeping.
After seeing countless babies with the problem, Dr. Jane decided to do something about it.
This is a Turtle. It's an FDA now cleared knit beanie with a repositioning roll.
The Turtle keeps the baby from getting used to one position.
We need to start this off when the babies are first born, enable the babies to get used to being rotated from side to side with their heads.
She says they should wear it daily and whenever they are against a flat surface. For babies like Kai, it could have prevented the helmet. And for little Easton, there could be just enough time to see some change and prevent problems when he's older.
And it is really that simple. So great. Dr. Jane is really fun to talk to. And if you can just move that every day so the baby doesn't get used to the one place that they lay, and then also picking them up more, because it's so easy to keep them in the carrier, take them inside in the carrier, but they need that tummy time.
I was shocked. One in every 2 to 3?
It's so common now. You see it all the time. My nephew had to wear the helmet for months, just like that. By the way, that product that she has now designed called the Turtle, you can find more information by going to turtle.com. One beanie costs $19.99.
I'm going to get that for my sister-in-law. Her baby's
gift,
due in a
isn't
couple
it?
of months.
Yeah, and they're cute too. They come in all different designs.
Hey, coming up next, it's